Hello, my name is Samantha. The purpose of this proposal is to recommend exercise as a treatment option for depression. According to the National Institute of Mental Health, approximately 17.3 million adults in the United States have had at least one major depressive episode. This represents 7.1% of all adults. Adults ages 18 to 25 had the highest prevalence of a major depressive episode at 13.1%. The prevalence of a major depressive episode is higher in adult females when compared to males. Healthy People 2030 has goals set out to address this issue. The goals include to increase the proportion of adults with a major depressive episode who receive treatment. Currently, 64.8% of adults receive treatment in the past 12 months for a depressive episode. The goal is to increase this percentage to 69.5%. Phil Marker's title model of mental health recovery and reclamation can be applied when working with patients with a diagnosis of major depressive disorder. The title model's main goals are to help people who are struggling with a considered breakdown and to recover as fully as possible, to help patients to get going again so they can begin to understand the breakdown, and to ensure that patients feel safe and secure when working with the Psych MP. When utilizing the title model, the Psych MP helps to identify, describe, and address the patient's issues that led to the breakdown. The model was initially established to help individuals who are dealing with a sense of loss of purpose, commonly seen in patients with depression. The Psych MP will help patients to express their thoughts and feelings appropriately and to understand how these feelings affect their vulnerability and safety. The Peacock question that contributed to this project proposal is as follows. In adults ages 18 and older who are diagnosed with depression, how does exercise or physical activity compared to no exercise or physical activity affect symptoms of major depression within a 3-month period? Various levels of research were done to help support this Peacock. A meta-analysis was completed to determine the effectiveness of exercise on depression as a treatment option. There were 4 studies with 77 total participants. Participants were 18 and older of both male and female gender. They must have been diagnosed with unipolar depression according to the DSM or ICD criteria. Studies were excluded where participants had diagnoses of seasonal depression or bipolar disorder. Types of exercises included walking, running, and strength training. Levels of depression were measured using the following depression scales: the Beck Depression Inventory, the Center for Epidemiological Studies for Depression, the Hamilton Rating Scale for Depression, and the Symptom 90 Checklist. When examining the 4 studies which compared exercise as a treatment option to depression to no intervention at all, there was a reduction in depression symptoms in those who completed exercise. There was a large and significant effect in favor of exercise. A randomized control trial was completed to determine the effectiveness of exercise on depression. Light, moderate, and vigorous exercise were all compared to no exercise. There was a total of 620 participants in the trial. There were 310 in the control group who did not complete any exercise. 106 participants completed light exercise, 105 completed moderate exercise, and 99 completed vigorous exercise. Exercise classes lasted 55 minutes and were completed 3 times a week. Participants were assigned by computer-generated program to the control group or one of the exercise groups. Most participants were diagnosed with both depressive and anxiety disorders. Levels of depression were measured using the Montgomery-Ashberg Depression Rating Scale at baseline and post-treatment. A score of 7 to 19 is considered mild and 20 or higher is moderate. Results showed more of a decrease in MADRS scores in all exercise categories when compared to the control group. A qualitative study was completed to explore patients' views of physical activity as a treatment for depression. The participants included 33 individuals who were taking part in an RCT that was assessing the effectiveness of physical activity for the management of depression. The study aimed for maximum variation in relation to age, sex, location, severity of depression, and self-reported activity level at baseline. The results in this study showed that most participants believed exercise is an acceptable treatment for depression as it can distract from negative thoughts and increase mood-enhancing chemicals such as serotonin and endorphins. Most participants stated a preference for physical activity over treatments, including medication. To implement this plan, the first step is to identify patients who would be appropriate for the project. These patients will be 18 or older, have a diagnosis of major depression, have no major pre-existing health conditions that would interfere with exercise, and who have an initial PHQ-9 score of 20 or higher. Patients will meet with the Psych NP initially to discuss the treatment plan and exercise options to determine what will work best for the patient. Patients will be encouraged to complete exercise for 3 times a week for 55 minutes a session for the 12 weeks. The patient can engage in exercise more often if preferred, but must complete a minimum of 3 days. The Psych NP will help to determine if the patient should be completing light, moderate, or high-level workouts with the interdisciplinary team, including the primary care provider and fitness professionals. The patient will engage in physical activity 3 times a week. The patient will meet with a therapist once a week to discuss progress and how they are feeling. The therapist will assess the patient's status and report to the team in weekly meetings. The Psych NP will meet with the patient once a month. During this time, they will re-administer the PHQ-9 and discuss the patient's progress. The Psych NP will be available to meet more frequently if needed. At the end of the 12 weeks, the PHQ-9 will be administered again to compare with the beginning score. It is important to be aware if the patient is taking antidepressant medications and to encourage complete compliance over the 12-week period so that the results remain consistent. The outcomes will be measured using the Patient Health Questionnaire form. The PHQ-9 is a screening tool used to quantify a patient's level of depression. The PHQ-9 will be given at the beginning of the project. Patients with a score of 20 or higher will be considered for the project. The Psych NP will meet with the patient once a month and re-administer the PHQ-9 at that time. This will allow the Psych NP to visualize the patient's progress and recommend any adjustments as needed. At the end of the 12 weeks, the PHQ-9 will be administered a final time to compare the patient's final score with the initial score. At the end of the 3 months, the data will be compiled and organized in a way to report to stakeholders. It can be presented in a formal report and may take an extended period for ensured accuracy. The hope is that the report will be ready for stakeholders within 3 months. The Gantt charts included show the estimated timeline and schedule for the Psych NP to meet with the patient and the PHQ-9 to be completed. The Gantt charts included in this poster show the prospective timeline for the project proposal. The Psych NP will meet monthly with the patient for 3 months. They'll be available if the patient needs to meet more frequently. The data will be compiled over the next 3 months and be ready to disseminate to stakeholders and to the public through brochures or research articles. The monthly breakdown is also shown with the interdisciplinary team meeting once in the first week of each month. The patient will meet with the therapist weekly and the patient will meet with the fitness instructor and complete the workout 3 times a week. The Psych NP will meet with the patient once a month to administer the PHQ-9 and again at the end of the 12-week period. That is my project proposal. Thank you all for viewing.